Hi, my name is Dr. Marisel Medina, and I'm the Foot and Ankle Specialist at Orthopaedic Center of South Florida. Today, we're going to talk about something that is very predominant in my practice, and that is plantar fasciitis and heel spurs. We have approximately 2 million people that are affected by this every year. This is possibly my number 2 type of diagnosis in the practice on a daily basis. Here is a foot model that I usually show my patients in the office of what the plantar fascia looks like. It is a ligament-type structure that attaches into the heel and up inside into each toe. This foot model in particular has everything marked in red. This is so prevalent that the models come nowadays so we can show the patients the area where they have the inflammation. So in the type of life that we live in, so busy and so fast-paced, many times we forget to do the exercises that are needed for the lower extremity. So therefore, plantar fasciitis is very prevalent because we do not stretch enough. Sometimes we want to be the weekend warriors. We want to do so many things and try so many different activities that on Monday I'm getting many calls that they're having much heel pain, and sometimes also even in the Achilles. We will talk about that on another segment. Risk factors for plantar fasciitis are quite a few, but one of the ones I see most in the office are my patients that have either flat arches or they have very high arches, which are my flat foot and my pes cavus patients. Also, I have the patients that are starting off a new routine exercising and they overstretch the plantar fascia and we get micro tears. Therefore, the body is trying to repair itself. It will cause an inflammatory response in the plantar aspect of the heel. Therefore, your first steps in the morning, the patients have much pain and discomfort. Now, there is a myth here. Everybody always assumes that the spur is what hurts. The spur is that continuation of bone. So that is not the issue. Our issue is this long, thin ligament that becomes thickened and inflamed. So non-surgical treatment for plantar fasciitis and heel spur syndrome is rest. I know that's very difficult to do, but sometimes if the patient is very, very busy, I will try to give them at least a cam boot, which will control their ankle and joint motion, and they're not putting all of their weight with their regular shoe gear. Many times we utilize that cam boot for at least 3 weeks. Along with that, I always like to provide simple things as ice, heat. It could be by a heating pad or soaks with warm water Epsom salts. And then my famous menthol rubs, which I love Vicks Vapor Rub, but you can use BioFreeze or Tiger Balm or whatever you might utilize or have in your home. One other thing that's important with this, after resting, we need to do some form of physical therapy. We need to teach the patient how to stretch adequately and correctly so this doesn't continue to happen to them throughout their lifetime. There are a few other modalities that I will use also in the office, ranging from night splints, as well as special shoes and orthotics, which are custom made for the patient's feet. And I do not want to leave out my acupuncture. I know it's out of the box, but it's very beneficial when patients have these types of inflammations in the feet. So after having a few weeks of therapy, it can range anywhere from 3 weeks to 8 weeks. If the patient is still not feeling better, I will then order an MRI to further assess the situation. Many times I will need to give a steroid injection, but we need to be very careful that there is no stress fracture or inflammation in the bone because we do not want to weaken that area with the steroid injection. Also, we can provide anti-inflammatory medication if it is applicable to that patient and they have no health issues. 90% of my patients actually do heal and the crisis is averted. But one of the most important things that I like to tell the patient is that they have to continue with warming up and stretching. I can provide many different modalities for the patient and medications, but if they don't continue stretching, the problem will reoccur. So for that 10% of the population that did not have any relief by any of the modalities that were given or suggested, there is surgery for this situation. Therefore, the plantar fascia will be released, but usually the bone spur will remain intact. So if this sounds like anything that you might be suffering from, please feel free to contact me in the office and I will gladly see you.